Hi, I'm Dr. Brian Wong, founder and CEO of the Bedside Trust, with video number 4. In videos number 2 and 3, we asked and answered the question, what matters most to patients and what matters most to physicians? Now the question must be more inclusive. What matters most to everybody else? We stayed with this physician audience who had established the trusted acronym, and we asked them the question, how do you pick a good nurse? How do you pick a good therapist or social worker or chaplain? Food services, environmental services, facilities. How do you pick a good supervisor, manager, director, or executive? How do you pick a good trustee? And after considering the acronym of trusted, they concluded rather rapidly that it was the same list. Fascinating to us, in what started as an exercise by physicians for physicians to define and describe what mattered most to physicians, quickly expanded to the universal attributes of a trusted colleague, which is the same thing as saying that what matters most to patients and what matters most to physicians also matters most to everyone else. Now that we've established what matters most to patients and to everybody in healthcare, it becomes more and more clear that what matters most to patients determines how we practice as leaders, which is to say that the leader's role in an organization, their first responsibility is to create environments that build, that foster, that cultivate this level of trust that we all want, that matters most to all of us. And if we do that, if we can do that in a systematic way, we begin to learn how to practice as patient-driven leaders, delivering what matters most to patients, to physicians, to the workforce, to the management team, to the Board of Trustees, and to the entire community. When we come back, we'll get into a little bit more detail about how we can actually begin practicing as patient-driven leaders. Thank you.